Coronavirus Outbreak. Top 10 Travel Guidelines. Coronavirus. It is important to take tips for prevention to avoid being infected with coronavirus. Highlights. Wear a medical mask when you are outdoors. Single-use masks should be discarded every day. Wash your hands after taking off the mask. Coronavirus death toll has risen to 80 in China. The novel coronavirus originated in Wuhan City and has infected around 2,744 people across the country. The virus causes pneumonia-like symptoms and targets the respiratory tract primarily. The World Health Organization states that the Wuhan coronavirus of 2019 CoV belongs to a large family of viruses that are known as coronaviruses. The virus can cause a range of symptoms including sore throat, flu, fever, and even more severe illnesses like severe acute respiratory syndrome, SARS-CoV, and Middle East Respiratory Syndrome, MERS-CoV. With the massive outbreak of coronavirus, it is important to take note of where you have traveled. So far, confirmed coronavirus cases have been from Hong Kong, Australia, Thailand, France, Japan, Taiwan, Vietnam, Singapore, South Korea, Macau, and Nepal. Also read. Coronavirus outbreak. Death toll rises to 80, over 2,700 confirmed cases. Our experts share prevention tips in case you have traveled to any of the affected countries in the past 14 days. Then following are the guidelines you need to follow. 1. For those who have traveled to any of these countries and are getting respiratory symptoms, they must be put into droplet and airborne isolation. Respiratory secretion of these patients should not come in contact with anyone else, recommends Dr. Laxman Jasani. 2. If you experience any respiratory symptoms like cough, cold, sneezing, wheezing or fever, go for a diagnosis immediately. 3. Stay in isolation if you experience these symptoms and stay away from people coughing and sneezing around you. 4. Do not forget to share your travel history with doctor when you go for a diagnosis. 5. Wear a medical mask at all times if you experience the symptoms. 6. When wearing the mask, avoid touching it. Also, make sure that the mask covers your mouth and nose. 7. If you are opting for a single-use mask, then discard the mask every day and wash your hands after removing it. 8. Avoid touching your hands, eyes, nose and mouth with unwashed hands. Use alcohol-based hand wash or soap to clean your hands. Wash your hands frequently with an alcohol-based cleanser. Photo credit. Istock 9. Avoid going in crowded places. 10. Cover your nose when you are around someone who is coughing or sneezing, etc. Also read. Coronavirus. Do people in India need to worry? Dr. Laxman Jasani, consultant, infectious diseases, Apollo Hospitals, Navi Mumbai. Disclaimer. This content, including advice, provides generic information only. It is in no way a substitute for qualified medical opinion. Always consult a specialist or your own doctor for more information. NDTV does not claim responsibility for this information.